Dr. Bagai, we've been speaking about these cough syrup stories for a while now. And I really want to say this, that since day one, we said this, that this is just the tip of the iceberg. Now, Rajasthan is one example where we are seeing the story go beyond cough syrups. You are seeing them question that why aren't the drug controllers, who are supposed to be your eyes and ears on the ground, who are supposed to be your safety mesh, your safety net to ensure that it doesn't reach our homes, they're just sitting on these files when they already know that they have failed it. So clearly it's a nexus, it's a case of corruption that has costed lives. Would you say now is the time to actually understand and go deep into the entire world of generics? I say this because let's just put this in context for our viewers. Advisory after advisory by the government, and Nihar Parekh also, chime in right after that, keep saying that, doctors should not be prescribing brands for different reasons, of course. Doctors should be prescribing generics to ensure it's affordable, to ensure that you are not in some way sort of favoring a particular brand. But stories like these, do they make you change your mind?
Good evening. I think the first and foremost, I think all our prayers, the entire nation's prayers and condolences for the families who've lost their small children and infants. This is an absolute horror story, unacceptable under any set of circumstances. There is a failure. It's a serial failure. It's a systemic failure at various levels. And somehow or the other, anyone who has a government job should not take it for granted that he's got a passport to luxury till he retires and post-retirement benefits. I think if someone is not performing, that person has to be axed. I would request the government of India, right to the PMO, to take out an iron hammer and pin down the people who are responsible. If it's the drug controller who's taking the responsibility, then the accountability must end with him. So if we need to change the gentleman, then so be it. Point number two, we need more number of manpower. We are grossly short of supervisors and manpower on the ground. And this we've known for the last 10 years. This is not a new story. So why is the deficiency of the resources still existing on the ground? Three is all the units who are performing with substandard drugs or adulterations or without safety measures or without what we call as quality control audits, they have to be stopped for life. These people cannot function under any circumstances. Lastly, there is a law. Now, who's going to implement the law? Under the new law of BSN, we know that there is an punishment of imprisonment up to life plus a punitive financial damage. Lock up the people who are the owners of the pharmaceutical companies for life. Set two examples pan-India, and you'll see how the rest of these people will fall in line. With regards to the use of drugs, I am never in favor of any pharmaceutical company. And I'm very proud of that. But the quality which is coming through any pharmaceutical company has to be authentic. Otherwise, we will lose patients and we may continue to lose precious lives. Over to you.
Yeah. Dr. Parekh, India has been such a shining example of affordable healthcare. We pride ourselves in saying that, this is one thing India has really cracked for a population of our size and one as diverse economically as we are as a nation. Yet here we are, perhaps for the first time, saying at what cost? What quality really?
So Sonal, it all boils down to, see, we as an Indian healthcare system is focused with the doctor at the fulcrum of everything, at the center of everything. And the trust begins and ends with the doctor. And when it comes to your child, the pediatrician or your family physician is the whole and soul of the entire healthcare. Now, that's a lot of responsibility on one person. So when you pick your doctor, the doctor needs to make sure that he's giving the best to your child when it comes to clinical diagnosis, when it comes to treatment, and when it comes to drugs. Now, when it comes to drugs, we take sole responsibility of writing brands down. Why? Because we know these companies who have been making these syrups and tablets for years. It has come down through our training. We've met these company people. They have explained us their making processes. They've explained us their clearances, their studies done. And when we know with all this information that these companies are valid, that's when we write a particular brand. Now, what is happening is there was a big hullabaloo or promotional push towards generic medicine, rightly so. But when the generics are non-trustworthy, and this is what happens when non-trustworthy medications, which small companies try and for their profit margins to go up, use substandard pharmaceutical, instead of using pharmaceutical forms of those derivatives, use industrial forms, this is what is bound to happen. So I tell all the patients that we have studied the companies that make these drugs. We have hands-on experiences with years of connections and relations, not financial, but of trust. So that's
Yeah, but
where
Dr.
these
Parekh,
things.
but if I have to be honest, I have to say this. We do know of doctors who prescribe only particular kind of drugs. We do know of doctors whose drugs and the brands that they prescribe are only found in the chemist shop near them. We know why that happens. I've been in covering health for a while to know the truth, even from the doctor's side. So I'm just finding it very hard to determine which way do we go. Do we trust the generics, which is the right intention to do, but nobody is doing checks there. This has to be centrally governed. And then equally, there need to be checks on the side of the doctors as well. Getting kickbacks, having MRs outside of your clinic is a reality of a day. Let's not deny that.
That's a fact. But MRs are not, medical representatives are not just for kickbacks. They are also there to explain the new drug launches. They're also there to explain which drug is working well. They're also there to explain you what studies have been done under these drugs for them to come out to the market. When we cross-question them about the cost, they have valid explanations why certain brands are costing more than other brands. See, look, in every profession, you're going to find those few bad apples who ruin the rest for everybody. But my end goal and my message, Sonal, is please trust your doctor, because your doctor is not there out there to harm your child. Your doctor does tremendous amount of research before prescribing drugs. Yes, there are few in every profession who spoil it for the other ones, who tarnish the name of those guys who are doing a good and a sincere job with their work. So now, till the government doesn't raise its bar, doesn't provide us good quality checks on the generic meds, we are left with very few options, because the last thing we want is such unnecessary deaths in those absolute harmless children who have done nothing wrong, and those parents whose only intention was to treat their sick child.
Dr. Bagai, this really worries me, and I'll tell you why. Because on one hand, I get it. It's easy to say trust your doctor. Perhaps it's easier for us to say this sitting in metros. Informed citizen, perhaps one watching this show today, people like you, people like me, will question our doctors. We are on the other extreme. We go and say, well, ChatGPT is telling us this about a medicine. Why did you prescribe? But there is a reality of an alternate India, right? Where they are going to the Aushadhi Kendra, where they are getting a fantastic program, where they get medicines for free by the government under the prescription. But if there is no control on the quality of those drugs, then what is the point of this program? Like, I'm just trying to say, where is the end responsibility here? Where does the buck stop? If we are to go ahead with affordable healthcare, it cannot come at the cost of lives. Who is to be looked at here? Clearly not the drug controller alone.
So, for many years, everyone has been talking of affordable, accessible, and accredited healthcare. And for me, the last word is most important, the accreditation. That means standardization. That means evidence-based medicine. That means quality of healthcare. That means safety of patient first. At a very larger level, and I'll talk more from an administrative point of view and a clinical point of view, and actually at a spiritual level. Doctors have to self-educate themselves. A degree 20 years back does not hold that good right
Absolutely.
now. Medicine is not like any other profession. And I've said this to every person who's joining in medicine. You want to make a lot of money, do some other business. You have to feel for the patient. Patient is a living soul. A patient is a person who comes to you in pain. He's come with trust. We cannot betray that trust. So self-education is extremely important. Point number 2 is doctors are, as it is, over-regulated.